What do you do when you're between that proverbial rock and a really, really hard place? You know exactly what I'm talking about, having to make those difficult, nearly impossible decisions concerning your health care. How do you make those choices? Today on the Transplant Helper, I'm going to be giving you 3 things I believe you need to implement right now in order to make better choices so that you can go away from them with no regrets. Stay tuned. Hey folks, welcome to the Transplant Helper again today. My name is Jim Merle. Let me go ahead and ask you, if you're not already subscribed to this channel, right now would be the perfect opportunity to do that. And hopefully I'll continue to provide you with content which will both advocate, educate, and motivate you as a transplant patient. And by the way, if you haven't already figured out my schedule, basically I'm going to be doing that every Tuesday and Thursday, somewhere around 4 p.m. in the afternoon. So if you want to be watching out for the content, that's pretty much when it's going to show up. With the exception, I'm going to be offering some bonus videos throughout the week that may come any other day of the week to help you out. Kind of some quick tip type things. But anyway, thank you so much for those of you who have subscribed, and especially for those who just hit that subscribe button. I look forward to being a part, or having you to be a part of this community in the future. Now, with that said, let's jump right into our topic of discussion today, and that is, what do you do when you're between that proverbial rock and that really, really hard place? You know, we've all been there. I've certainly been there when the doctors present to me options and choices and decisions to make, and all I can do is just about pull my hair out, what little I have, or scratch my forehead, rub it all up, trying to decide what in the world to do. And I think if you'll implement these 3 things today, it'll make those decisions not only a lot easier, a lot less burdensome, but especially help to remove some of that regret in hindsight as we look back on the decisions that we make. And here's how we need to start it off. Number 1, the first thing you need to do if you're going to make good decisions is to involve other people. It doesn't matter how difficult the decision is, whether it's just some minor something or something really big, which is primarily where we're focusing today. Go ahead and involve other people. And particularly what I'm talking about here in the first place on that subheading is to involve your team, involve your doctors, your coordinators, your nurses, pretty much anybody you interact with in clinic. They need to be involved in your decision. Let's use an example throughout this. I know this won't apply to every type of transplant. This will mainly be heart. However, the decision-making process will go for everybody: heart, lung, liver, kidney, pancreas, or any other thing that you deal with in life health-wise. But when I talk about involving your team, let's use the example that I go in, which I did 5-6 years ago, that I go into my team one day, they look me in the eye and they say, "Jim, here's what we think. We think we ought to be putting in you an LVAD, a left ventricular assist device." I've had a program on that. I'll link up here in the corners as well as in the description below. Go back and watch that. But they come in and they say, "Jim, you need an LVAD." I look at them and I think to myself, no, I don't really want an LVAD. As a matter of fact, I don't want to be tethered to a wall plug all day, or toting a battery pack around, or dealing with whatever else goes with the LVAD. I don't want to have to deal with that. And by the way, they added to that whenever you get this LVAD, while you're healing from that surgery, which at the time was about 3 months, it's a little less now, but while you're healing from that surgery, Jim, we're going to take you off the list. Well, I'm thinking to myself, hey, I'm on the list. I've been on the list. I'm moving my way up the list. And now you're threatening to install something in me that's going to take me off the list? No, I can't do that. That's a proverbial rock and a really, really hard place. How do I make that decision? Well, by involving others while I'm there in the clinic and asking my doctors pointed questions. Things like, do you believe this is my only option? Or do you believe this is the best option? That sort of thing. You're involving them now in your decision. And I mean, just kind of, being kind about it. Don't be rude, but pin your doctors up and say, I would like for you to prove your case. Tell me exactly why you believe this is the best decision. And that way you walk around with more of this information than just going, okay, so they recommended an LVAD, so they must want me to have it, so they must think that's the thing for me. No, clear all that up, ask those questions, be direct, be kind, but be direct, and say, why does this need to happen? Explain it to me, lay it all out, give me the best information to use. And then once you do that, not only involve your team, your doctors, go home and involve your family. Have a sit down. Pull your family members together. Whoever's around you the most, whoever's most concerned or the most knowledgeable about your condition. And now you can tell them all the things the doctor said all this information, you can say, hey, look, what do you think about this? What's your advice on this? How do you believe I ought to turn? How do I ought to go? It's going to ultimately be your decision. I get that. It's going to be between you and your team more than you and your family. But, a lot of times your family has the ability to weigh in on some things that maybe you didn't think about. Or they weigh in on some things from a whole different perspective than you do. And I would say, like back then, my wife, she wasn't a fan of the LVAD either, but she was watching me sleep 16, 18 hours a day and pretty much have no quality of life. And so for her, she might have been thinking to herself, I wish he would get at the LVAD. I'm afraid he's not going to make it if he doesn't. You see, you're involving others. And so number one, when you have to make a tough decision, involve others. Number two, and it sounds a lot like that, not only involve others, but invite others. Invite others. You say, well, that does sound a lot like the first one. Well, sort of. But what I mean by this is you've already got your team, you've already got your family. Now you need to make an effort to go out and invite other people to sit down, to have discussions with you, and to get involved in the decision by inviting them to be a part of it. And particularly, I think the best place to do that might be starting in your transplant clinic. When you go to clinic, when you're in your transplant center, me, for example, I go to UAB Hospital, a huge transplant center. Anytime I go to clinic, I'm surrounded by anywhere from 40 to 60 other heart transplant patients, pre and or post. And I don't mind, starting a conversation about the weather and then having it end with us talking about our conditions. Here's what's going on with me, or here's what's gone on with me, and then allowing them to speak to me, as I like to do to you, as someone who has been there and is currently doing that. Because more than likely, you're going to find someone in clinic who can say, you know what, I had to go through exactly the same thing last year, the year before, whenever it was, and here's how it worked out for me. Again, using the example of an LVAD, it's not very hard to walk into a transplant clinic these days, heart transplant clinic at least, and see someone sitting across the room with an LVAD. And if I'm facing an LVAD or potentially facing one, I'm going to beeline it over there to them. If I can't find a seat, stand or roll up a wheelchair and say, sir, I hate to bother you, but I'm facing this LVAD like you have. Tell me about it. And that's really the best way to get information to make a good decision. And you can also do that, by the way, outside of your clinic, getting on some of these Facebook groups. And I understand Facebook groups can get a little messy sometimes, and I understand that you certainly can't trust that information above that of your doctors and all, but you will really, really quickly find people. Just get on there and saying, look, I'm facing an LVAD, or I'm facing whatever treatment, whatever problem this is. Has anyone here dealt with that? I promise you, within minutes, there'll be stacks of people commenting below. And then you can take that and maybe pick one out and say, hey, do you mind if I private message you? Can I get in touch with you? Would you please help me with this? I promise you somebody will do it. It's absolutely great. And then the third place, and this one's serious, invoke others. Invoke others. And again, this is similar to the previous two things we've said, but here what I'm talking about is once you've got your doctors saying, okay, here's what we think, once you got your family saying, okay, here's what we think, maybe you met some people in clinic and they say, here's what I've experienced. Now you take all that information together and you start helping to motivate people to make moves. If you've concluded by our example, yeah, I need the LVAD, the next clinic visit, the next opportunity, I'm going to invoke my doctors and say, okay, look, I've come to the conclusion, like maybe you have, that I need the LVAD. When can we do that? When can we get started on the process? When can we start down this road so we can get to the end of the road? You got to start to get to the end. So invoke them. That is, push them, drive them, be the fire underneath them to drive them to do whatever it is you have deemed appropriate to do. You see, you made your decision, and so let's implement that decision. That's one way of saying it, but invoke them. And you do the same thing in the reverse with your friends and family. They sat down, they help you make the choice. Now that you've made the choice and the choice has been made, now you invoke them. It's okay. I'm going to need your help. I'm going to need your help for a while after this, and I need you to come in and do your part because you have to do your part. I can't go this alone, and that's the real key to all of this. So what do you do if you're between that rock and a proverbial hard place? Number one, involve others. Number two, invite others. And number three, invoke others. Make them get to work. Now, I hope this has helped you out in some way. If it has, how about go ahead and give me a big thumbs up or a like on this video? That just encourages me more or less. And again, consider subscribing if you're not. And here's the thing, I would love you to comment below right now. Go ahead and comment below. Tell me about the tough decisions you've had to make, how they went, how you even came to those conclusions. That would be huge for me to see that, as well as for the entire Transplant Helper community. But until next time, friends, please stay stronger.